conversation. I'd like to very much welcome everyone today joining us for our first meeting of 2021, and what I hope will be one of the more interesting talks that we will have. We would love to have personal guests meeting in the Clubhouse Hotel, where we could treat our guest to lunch and listen to them talk about their life and work. The Zoom talks do, however, offer us an opportunity to meet with people who would never find their way to making an hour available on a Monday afternoon. And Greg Price, who I have known for over 20 years now, when I was working with the Citizens Information Board, he and I were sitting on the board of what was then South Tipperary Citizens Information Service. And our job was primarily to merge North and South Tipperary Citizens Information Services. And that proved quite an uphill task. I think in the end, the Citizens Information Board and the GAA were the only two organizations in the country that recognized Tipperary as one entity. Of course, that's all changed now. But Greg was on the board because at the time he was Superintendent Community Welfare Officer in South Tipperary. But Greg, your work with the HSE began long before that. When did you start working with the HSE, or the South Eastern Health Board as it then was?
Well, actually, I started out in the Eastern Health Board, and in my college days, I worked as a porter, a telephonist, and all kinds of things in Naas General Hospital. It was quite a small hospital then. I did everything from that a porter would do, including doing some work in the mortuary and carving up dead bodies and what have you at the time, which was for a 19-year-old pretty daunting at that particular time. But then I moved on and I started out as a community welfare officer, and I worked, my first appointment was to Lord Edward Street and Bride Street in Dublin. So I did all the flats, as they were called, up around that particular area at that time. Then I moved out to Blanchardstown for a while, then to Ballyfermot, and then moved to Kildare Town, which incorporated the Cork camp and also Rathangan. And then eventually I went back to Dublin as a Superintendent Community Welfare Officer for about 11 months before I transferred down to the pastures of South Tipperary. And I remember in my last full year in Kildare, which was 1994, at that time I had spent 500,000 pounds or thereabouts on my own as a community welfare officer. And when I moved to South Tipperary, I discovered that between 10 of them, they didn't even manage to get up to 500,000. And I said, there has to be something wrong. There has to be as much poverty at the time in South Tipperary as there was above in the rich pastures of Kildare. And I suppose I came from the school where I was trying to do my best to help people, whereas, and it's no fault of the people working in South Tipperary at the time, where it was drilled into them, you give people as little as you can get away with. And I suppose very quickly the expenditure went up. I remember my last year there, we had spent 8 million, which is almost 20 years ago, which was a phenomenal amount. After that, then I moved into complaints and appeals with the South Eastern Health Board, and worked on that then for a couple of years until such time as the HSE came into being. And then when the HSE came into being in 2005, well, by 2007, I suppose, by the time we got relocated, and then I moved into the whole area of advocacy within the HSE. So it was, I think at the time it was called Consumer Affairs Department, then it changed to the Advocacy Unit, and now we call it more partnering with patients, service users, families, carers, and that. And that's really about trying to be proactive in involving people in not just their own care, but in the care of their relatives and friends, but also having input into the design, the delivery, the planning, the measurement of services. And as I said to Ian just a little bit earlier, that has been quite an uphill struggle, because sometimes management feel that they know best. Almost doctor knows best, whereas there's nobody knows their own body like the patient themselves and how they feel and whatever else. And I think somebody said once, it was in the British Medical Journal, that you go in for a consultation with a GP, and within 30 seconds before he has even heard you out or she has heard you out, they begin to diagnose. Whereas the research at the time would have said that it takes people at least 3 minutes to tell their story. I suppose the doctor is conscious of people coming in behind them and other people coming in and trying to get through it. So that has taken me up to last March, I suppose, when the pandemic really hit us. And I have more or less been involved in contact tracing since then. And we're right in the middle of the big surge at the moment. And you're hearing all kinds of things in the news about figures and what have you. But just to give you an example of yesterday, we had 25,000 results yesterday. And now this probably won't be announced for about 2 or 3 days, and it could even be longer because they're having difficulty with whatever computer system they're using. But the number of positive cases that were detected yesterday was 6,840. So that's a positivity rate of 27.3%. And it's a colossal figure. And we could have, they're expecting maybe the peak tomorrow. So we could be looking at maybe 7,000 to 8,000 cases, or maybe even more tomorrow. I'm not too sure. On average, we're getting through about 6,000 cases a day, which isn't too bad. But we're still, like when we came in on the system this morning, there was 6,611 cases there. So you can imagine the task it is trying to ring people. I was working on New Year's Day and nobody was answering the phone before 12 or 1 o'clock. So we start work at 8 o'clock in the morning. We keep going until 8 o'clock at night. And so we had a lot of unanswered calls. Then when we were calling close contacts, up to an awful lot of people who were close contacts weren't answering the phone. We think because they didn't want to be told they were close contacts. Or whatever, and even maybe where somebody would answer the phone, the next thing, once they hear who you are, the phone was put down or they press the red button on the phone. So it is difficult. Like what I told the staff here on Saturday was, what we're about is really helping people to stay safe and saving lives, essentially. So our job is to close down the positive cases very quickly, get them to self-isolate, and so that they're not actually spreading it to anybody else other than the people that they've been in contact with for 2 or 3 days before they actually became symptomatic, or even asymptomatic, but before they became positive, because it doesn't really matter whether you have symptoms or don't have symptoms. In some cases, even with no symptoms, you're still passing on this horrible disease. And it affects everybody differently. You hear so many people that are completely asymptomatic and no queries, but maybe 3 months, 4 months down the road, they begin to have problems with their lungs, with their heart, or kidneys, or whatever as the case may be. And so we're talking about long COVID. We now even have a support group for people who have being detected as positive, who have multiple things wrong with them because of the actual disease. And that seems to be the case. Like there's one support group I know, we have 800 people in it, and we're trying to access all kinds of services for them. So the knock-on long-term effects of this disease is nobody knows what it's going to be for some time, but it is going to leave a lasting effect. A lot, I suppose, if we go back to last March, everybody played their part. There is no doubt about that. You were nearly afraid to walk by somebody on the street without moving out about 6, 10, 12 yards from them, giving them a wide berth. And really, that's where we need to go back to again. I think Tony Houlihan has said, we all need to be treat ourselves as if we're infectious and act accordingly. Stay at home for as much as we can, trying not to mingle with people, have as few contacts as we possibly can. And that worked back in March. Now, we haven't seen these numbers back in March, but remember back in March and April, we weren't testing nearly as many people. But I reckon if we were testing as many people back in March and April, we probably would be looking at similar kind of numbers. And you know, there are some quite harrowing stories that people don't hear about, and they can be, I suppose, very, very difficult for particular families. I remember one morning we spoke to a 79-year-old woman to tell her she was positive. She already knew, but what was she doing? She was preparing to watch her husband's funeral mass on a webcam.
Oh.
You know, pretty harrowing stuff. Her daughter was also positive. So they could only go to the graveyard, but they weren't even allowed to get out of the car at the graveyard. So they're the kind of things that haven't hit the media. We called another family one day, a young man, he was only 21, and both his mother and father were in the ICU in hospital, and he was left looking after 4 other children of the family. And I don't know the outcome of that particular case, but they're real life situations. I remember another very difficult situation was ringing a woman one Saturday morning. And the sad part about that was her son had just died by suicide 2 hours earlier. So it's you get into the tragedies of, that wasn't caused by COVID as such, but it was just one thing more she had to cope with, as well as getting a positive diagnosis and being seriously ill. Like, you know, we talk to people who are breathless on the other end of the phone. We talk to a 90-year-old woman on Thursday or Friday last week here, and she had no symptoms whatsoever. It's just, it's everybody can be affected differently. I know people that I know pretty well, 2 sisters, one has symptoms, is in ICU, is not very well at all, and the other sister is at home positive but has no symptoms whatsoever. So it's just, it's one of these things that I suppose we're not going to get a handle on. Nobody knows. So it's the people with no symptoms are the ones we really have to be careful of. And any of us could be positive and we don't know. That is the tough part about it. So that's really what our job is about, is trying to get people to stay safe, to self-isolate. And then we were contacting their close contacts. Now, in the last few days, the number of contacts has reduced, but say up to and including New Year's Day and maybe even the day after, we were getting people who had 15, 20, 25, 30, 35 contacts. And there was no way could we continue calling all of those people, but they all get a text message now telling them that they're a close contact and that they must restrict their movements for 14 days. And if they get symptomatic, then to contact their GP to organize a test for them. Right. So that's it in a nutshell. So what we're trying to do, I suppose, is keep the country safe. Are we succeeding to a certain extent? Yes, we are, in the fact that we get people to self-isolate. Is the message getting out there? I think in the last 2 days, yes, because the number of close contacts is beginning to come down. I think the average this morning was somewhere about 3.5, 3.8 close contacts per person. But that could vary from none up to 25 or 30 in some particular cases.
Yeah. Can you tell me, Greg, when you start this process, how do you get, how is it, somebody is diagnosed as being COVID positive? How do they know who their close contacts have been? Are you relying on their memory or their selective memory? Or is there a more technical way of helping accumulate the list of contacts? For example, using the app on, is the app of any effectiveness at all?
Yeah, the app is very good if it's used, but an awful lot of people have deleted it from their phones.
Actually, that's a very good point, Craig, because I remember when it first came out, there was a big surge. Almost 1 million people downloaded it within the first couple of days. Then about 2 weeks later, it came out that it was draining the batteries on Android phones. And a lot of people deleted the app. But there was no PR to encourage people to re-upload it once that glitch had been fixed. And I think a lot of people who had it no longer use it.
That is true, Ian. And I suppose in the last couple of days, I have heard it being advertised on the radio for people to download it and help keep the country safe. But
maybe they need to also publicize the fact that the previous issue, that all issues
has been sorted.
You know, and that might encourage people to re-upload it again.
Yeah, I have a slightly different theory on it. I think people don't want to know that they've been in close contact with somebody. And now that's my own personal opinion on it, because we do know from, you talked about relying on people's memory. Yes, we are relying on people's memory as to who they've been in contact with the 2 days previous to the onset of symptoms or to the onset of the positive test. And that's why I suppose the less people we mingle with and that we have as contacts, the better. But
so once somebody is diagnosed and they say, I was in contact with Joe Bloggs and Mary Murphy and such and such a person, they then have to give you their contact details.
They have to give us their contact details, their mobile telephone number, or their landline telephone number if they don't have a mobile telephone number, or some way that we can get in contact with them. And we need, in order for it to be effective, we need to be able to get in touch with at least 80% of those people. From a public health perspective, they reckon if we can get 80% of people to comply, well, that's very high. And you'll hear that in relation to the different vaccines. Like while one is 95% effective, another one may only be 65, 70%, but they'd be very happy with the 65 or 70%. So it is really about trying to get as many people to restrict their movements and to self-isolate as possible. Now, the difference with the self-isolation, if somebody is deemed positive, that means they must have no contact with anybody else. Unless you happen to be a mother or a father and you have very young children, well, then you're going to have to keep contact with the children. You can't self-isolate yourself away from the children. But for the most part, we do try to get people to self-isolate in their own room and not, to use their own bathroom, not to share insofar as that's not always possible in every house. But if they are sharing, it's so important to sanitize after you've used it. And that other people can come in and they sanitize it as well. Like say here in the center where we are, I don't touch a desk without sanitizing it first. I don't touch a computer without sanitizing it first. I don't sit on a chair without sanitizing it. And then when I'm finished, I go through that whole process again. And if there's somebody else coming into a desk here, then they go through that process, because you just really can't take enough precautions in relation to this particular disease, unfortunately.
Yeah. There have been some notorious cases that one hears about anecdotally. A funeral that was held in County Wexford where a 90-year-old woman with 9 children died. The family tried to get a hotel to have the after funeral reception. All hotels refused, so they built a marquee. They had a marquee. As a result, 2 people attending the funeral were spreaders. There's the son, both 2 of her 9 children got it. One of since died. Why or not? Is it a good idea or counterproductive to publicize such events?
I think the more people know, the better,
Mm.
and that they should be publicized. It's
Without,
like,
I mean, obviously everyone will start shaming them then, but I think the story shows just how pernicious the virus is, and people need to think we're not immune after all.
yeah, no, and if you look, in fairness, some of the newspapers have been carrying some good stories. The Irish Times a couple of weeks ago showed where one case managed to be infect the cause of 50 other people plus being infected.
Yes.
So this particular individual was infectious. They mingled with other people, infected them. One of those other people got tested, didn't
Okay,
feel well, went for a test, but when you don't feel well, you're
Yeah.
supposed to self-isolate straight away until you get the result of your test. But after going for the test, she began to feel a bit better and decided to go to a party that night. And the test came back the next day positive, so she infected more people, with the result that all of that one case led to about 50 people being infected. And it can so happen, and like funerals, have been the cause of a lot of cases, but there are a lot of other social gatherings over Christmas, even though there was supposed to be no work parties or anything like that. There were some. They were entertained in some gastro pubs, some hotels, and it's just it's pretty sad, but they're the kind of things. But I suppose there is the whole issue of shaming people, and maybe that's the reason why they're not going after it, because it is a tragedy. And my understanding is that there are a number of people, say, that attended that funeral who are very seriously ill in hospital at the moment. And it's just, I think people got it back in March or April, but a complacency has really set in the last couple of months, and people are fatigued by the whole thing.
I was going to say, is it complacency or is it simply fatigue from
Fatigue, yeah.
we're just not
People don't engage anymore. They don't watch the news about it. They not interested in the numbers or the figures or anything like that. You can see, I don't know what the actual figure is this morning, but we're over 700 people in hospital now. Not too sure, I didn't get the latest ICU numbers, but it has doubled, say, or trebled in the space of a week. So it is, and somebody isn't put into an ICU bed unless they actually need it.
Yes.
And then you have people out there who say the whole thing is a hoax. So.
Well, indeed. I mean, but that great humanitarian Joseph Stalin once said, the death of one person is a tragedy. The death of 1 million people is a statistic. And if people still just see numbers, they blank out. They can't cope with, their brain isn't tuned in to numbers. We don't know whether 700 people in hospital with COVID is a serious number or not. After all, we have thousands of hospital beds. So it's making it relevant, bringing it down to the individual, bringing it and that's why I think one of the Irish Times articles, the death, those we have lost, was quite poignant. And that does show that it's not simply the older generation dying a bit earlier, that these are real lives that are being taken from a community, and the community is suffering and not able to commemorate the contribution that that person has made in their life, because funerals which are such a valuable part of Irish society, have not been able to be held. And it's affected everybody's lives, but and older people may be dying more, but it's the young people's lives that I think are going to be most affected. First of all, their education is being diminished. Secondly, their social interaction is being constrained. And thirdly, which hasn't been meant, they're going to have to pay for all of this in generations to come.
Yeah, absolutely, and we do have to take cognizance of people's mental health through all of this. Like we are, particularly vulnerable people. We're asking them to cocoon, to use that horrible phrase, and to stay at home and not to come out and not to interact. And while Zoom and FaceTime and all, WhatsApp, whatever it is, has been great, you know, to still think that you can't actually shake hands with somebody when you meet them.
Yes.
And like, and funerals, shaking hands was such an important part of it. And I know of a funeral not too many weeks ago where there was 100 people in a graveyard, and each one of them went up and shook hands with the bereaved, and you just, you stand back. But it is the natural thing to do. Would you talk about this disease doesn't discriminate? Not too long ago in Kilkenny, we had a 51-year-old man who was healthy, no underlying conditions, died. A couple of weeks before that, a 32-year-old in Carlow, again, a healthy young man, no underlying conditions, died. And people can feel well now, even though they have the disease or whatever, they might have had a few symptoms, but it can, the doctors tell me, it can change in the space of half an hour, that you can literally go downhill that quickly. And you definitely need ICU support, oxygen, and all that kind of thing. But yeah, it's going to be the long-term effects, apart from the health issues that people are going to be left with. But the thing what you talk about, children's education, and children above all need to socialize more. Yeah. And now we're telling people they can't go out, and youngsters, and play with their neighbors' kids or whatever, as the case may be. You know, so that whole social interaction is it is lost at the moment.
Mm. But it will come back. The question is how long we have the capacity to endure the current restrictions. It's fine for somebody like myself. It's an inconvenience that I can't do the various things I'd like to do, but it's not life-threatening. And it's not the fact that I can't meet people, that I can't do the various things in the way that I used to do them. It's not the end of the world. But for some people, it is. They've lost their jobs. They may lose their homes, all because other people haven't adhered, don't fully understand the negative consequences of this pernicious virus. When you contact people and they slam down the phone, as you think I'm going to say, is there any follow-up to that? Or are you relying on people's goodwill?
No. To a certain extent, we do. And in fairness, 99% of people are good about it, particularly people who are getting a positive result and they want to do, and some of them are so sick anyway, they know they have to do the right thing. Sometimes it can be a little bit difficult for the person with no symptoms. Sure, I'm grand, I'm not doing any harm to anybody, but you're still telling them they need to confine themselves to their own room or their own space for 10 days or whatever, and then you're telling their close contacts 14 days.
Yeah.
That they have to restrict their movements. Now, that restricting your movements is not quite, you're not supposed to go to the shops or anything like that, but you can go out for a walk. You can mingle with other members of your family at a distance and what have you. So it's not quite as bad as the people self-isolating. But, yeah. And I suppose it's the close contacts more than the people who get the positive result are the ones who don't want to know that they're in a close contact. And some of them will try to convince you that they weren't in a close contact, that no, I wasn't in that person's company for 15 minutes. Whereas, you just throw a few questions and you know straight away they were not just a few minutes, they were probably a couple of hours with them.
Yes.
And that, so it does it. But then, yeah, what happens is public health operate under a 1947 Public Health Act, and they have enforcement power. So if our system allows us to specialize cases, make them complex or whatever as the case may be, goes on to public health, and there is follow-up with people. But I said the main thing is in the close contacts is trying to get 80% of people to restrict their movement. So if they're in or around the 85%, they usually are happy enough with that. So they won't necessarily go after each individual case. They'll kind of do a risk assessment and see what is the best thing to do.
Right. So I get a phone call from the contact tracing service in Cork, and it says that I've been in close contact with Joe Bloggs, who has been diagnosed positive. And I say, oh, thank you for letting me know. I will now restrict my movements for a number of days. But I don't. I just tell you I'm going to. Is there any follow-up with me later to see how am I doing? Have I been diagnosed? Or are you simply feeling the job is done, we've made contact, and the person has said they will agree?
Yeah. Firstly, we won't tell you who the person was that you were in close contact with, but that person may have contacted you themselves anyway, so you probably know, or you have a fair idea as to who the individual might be. But then we have other people who are diagnosed positive and they haven't a clue where they might have picked it up. But you can pick this thing up from ringing a doorbell, from touching anything that anybody else may have touched. And hence the importance of washing your hands. Yeah, I have no doubt that people don't always do what we tell them in the line of restricting their movements. Up to whatever day it was last week that we stopped getting people tested. Yes, we used to do, well, people used to get a text every day just checking in with them, seeing were they okay. But they also were put in for 2 tests on what they called day 0 and day 7. And then that was changed to just 1 test on day 5. But now that's not actually happening unless people develop symptoms and they contact their GP. So up to the huge surge in numbers last week, we were contacting people, but now we just don't have the capacity to do it.
Yeah.
And, you know, a lot of people giving out about the government, giving out about the HSE and what have you, but a lot of it comes down to personal responsibility.
Well, indeed. I mean, that's that.
Yeah.
If people adhered to the guidelines, we wouldn't be in the situation that we're in now. Has the time come for to move beyond the explain and encourage the 3 E's to enforce?
Very difficult. I would think where we're at, it's a kind of unlikely to happen in this country. No doubt it will lead to protests, which would become
super spreaders themselves.
Absolutely, yeah, and all of that. So you just have to appeal to people's better nature. And for the most part, people are very good and are doing it and do get the seriousness of it. And but it's not something that has touched everybody because we were so successful in the very early stages. Like I know that the planning that was done last February and March, you know, when we saw what was happening in Italy, they were preparing temporary mortuaries. They were looking at where they were going to build mass graves. And thankfully, none of that came to pass here. Whereas in somewhere like New York, it did come to pass. And as we saw in Italy, what happened there. But I don't think we'll get to the stage where it will be enforcement. Like, because I'm on the road up and down to Clonmel, from Clonmel to Cork, I was stopped at a lot of guarded checkpoints at times, and when they would figure out where I was going or coming from, they'd say, "Are you getting as much abuse as we're getting?" So the guards were obviously being told where to go at times too, you know. So people are, I suppose, very protective of their free will and what they can and can't do. But, you know, sometimes that can be very selfish. While we have free will, we have to look out for other people as well. And it is about, you know, treating others as they were directly related to us. And because it's a tragedy for anybody. Like, no, like, it's so difficult. I was talking to a friend of mine on the phone, I think it was Sunday evening, and she was telling me that her husband had been in hospital for 8 days before Christmas, and he found it very difficult to cope because of no visitors. Now, I know of another friend of mine who is 84, who had got a stroke, had been in hospital for 6 weeks without a visit from a family member, with the result that the man is completely confused now. And anybody he was seeing in the hospitals, they were masked up, they were gowned up. He picked up COVID while he was in hospital because it was in one of the hospitals where there was, unfortunately, an outbreak. Now he has come through it, but really he has gone downhill, and it's unlikely he'll ever go home again. But so there are all of those stories. Very difficult for staff in hospitals too, and they are doing their best, again bringing iPads to people and hoping that people can at least talk to their loved ones in that particular way. But it's not easy.
No. One of the things about Ireland is that we do have a sense of community, and there's a big difference in Britain between the north and the south, and it's much bigger. But in Ireland, we're small enough to be able to garner together that mehel spirit, that community spirit. Is there something that can be done or should be done to encourage people to engage more? I mean, it's a bit. I'm thinking of the various announcements by Micheál Martin, who's doing his best, I think, but there is a sense that he's a teacher telling us how we should behave. And it's not easy to get people to really buy in because of the fatigue. We've dealt with this for a year and we still have more. It's not getting any better after all we've done. In fact, it's getting worse. Is there something that should be done or could be done to engage people more?
It's very difficult. I think I saw a comment from Michael O'Regan, who was very engaged with this whole process last week, to say that the Taoiseach's talks to the nations have lost their spark. Maybe because people have tuned out, maybe because they've done it too often. I honestly don't know. It is very, very, very difficult one to say. And I think your point earlier on, Ian, about people getting the hard stories, how it affects people, how the whole thing is spread, that doing that, it may come to pass. But then, as I said, there are so many people who get it, don't know they have it, or even if they do, they're completely asymptomatic and they feel, so this is nothing.
Yeah.
So
is there a particular issue with different communities within Ireland? I'm thinking particularly of the non-Irish, relatively recently immigrant population who may be living in direct provision or maybe living in very crowded situations. The traveller community, or people who are otherwise marginalised. Are they more marginalised because of this?
That's a difficult one, and we do have special task force set up to deal with all of those particular situations. And yeah, I suppose it's very difficult because, like, if you're in direct provision, what do? You have nowhere to go. You have nowhere else to go at the moment. And anybody who's in direct provision that is tested positive, our first thing is we try and get them out of it as quickly as we can and get them up to City West there so that they are able to self-isolate up there. But then there's huge stigma attached to it when they go back, because other people feel they have been completely discommoded because this person, for whatever reason, is not positive. The traveling community, it's a very difficult one because they believe themselves, I think, to be invincible, and that they can continue doing what they want to do. And like sometimes when we ring, say, you can hear, you're talking to a woman, but you can hear instructions being issued from the man of the house behind. So it is difficult. But for the most part, all you can do is try to explain as best you can. And because they are a particularly vulnerable group,
Yes.
given all the different conditions that they might have themselves. And that, but I think a lot of them depend on their religious beliefs and relics and going to knock and doing things like that that they think will keep them safe. And
Yeah,
maybe it is.
I
So
know. And
it's
to be fair
difficult.
to Pave Point, they've been very clear about, and they usually act in defense of whatever behavior is being conducted by the traveller community, but they've been very clear about things that are within the traveller culture need to be put aside for the time being. Funerals and weddings in particular, that you can't have people gathering in the numbers, and yet they still happen.
Yeah.
Yet they will happen surreptitiously. And it's a danger, not just to themselves, but to others in the community. But it's an issue that I'm sure is not unique in Ireland, that there are deniers for whatever reason, that this is a big problem. I'm just wondering whether there's anybody else who has any questions for Greg. You can unmute yourself if you do have a question. I'm sure there are people who have some comments to make. Is
I have a question.
Yes, Nora.
Why are masks not mandatory inside and outside, inside stores, on the street? If you walk through Kilkenny, very few people are wearing masks on the street, and it's a very narrow street. Why are they not mandatory?
Nora, is it?
Yeah, that's
Yeah.
Nora Ward.
Yes.
Yeah, Nora, I was in Kilkenny a couple of weeks ago on a Saturday morning. I just had to transact a little bit of business there. And I was walking down the street with no mask on me. But I was actually taken by the number of people wearing masks, and I felt shamed into wearing my mask on the street in Kilkenny, and like that in the shops. But you're right, some people are slow to wear masks in shops or whatever, and some shops are very slow to tell them not to come in. Like, I mean, they should say straight away, you must wear a mask if you want to come in here. They would say the evidence is not there out in the street unless it's crowded. And I suppose you could say it was crowded around Christmas time and leading up to New Year. And it was good to see people wearing them, but you have then the people out there who are saying, no, masks, why would anybody wear a mask or whatever? So it is very difficult. So again, it's public health advice rather than making it mandatory. The government would have to bring in legislation and all of that, and I don't know why. It's like the guards, they have very little power to turn you back on the road unless you do it of your own free will. When you tell them where you're going, or sure, like I know for some people, but I thought the great out the last time was if you wanted to visit a grave, and say you wanted to go to Donegal and you lived in Cork, you could say, sure, I'm on my way to visit a grave in Donegal. I thought it was a rather strange one to give people that kind of freedom. And some people just do things because they can. So they don't wear masks because nobody is going to challenge them, and they feel they can get away with it. But if you go back to the early days, I remember going into a supermarket in Clonmel, and I was probably one of the very few people wearing a mask, long before they were ever mandatory. And like, you felt very much out of place. But now if you go into a supermarket and you're not wearing a mask, the opposite thing is there, that you feel very much out of place. So I think it is better than it was, and an awful lot better. But I'd say the reason is the government just won't go that extra step and put it into legislation.
But it's not a panacea. It is, but it's amongst the arrows we have in our quiver, that we have to wear masks as well as doing everything else. Wearing a mask will not immunize you. It just will stop you spreading it to others. Are there things that that you would like to see being done that are not currently being done by your own service?
I'm sure, yeah, I would like the message given to be an awful lot more firmer. I would like the stories that we hear every day to be out there for other people to hear. Now, I know you have to be careful of that too, because people can become readily identifiable. You know, so for example, if I talk about the young man who was 21 and both his parents in an ICU, if that went out there, sure, everybody in the community would know who it was in that particular community, whereas that's not what your focus is. It's to try and give
Yes.
a message out there.
But
we
maybe,
would,
just maybe, you could talk to that person and say, would you mind if we used your story to publicize this? Because they will have seen the damage firsthand, and they may be very willing to share in their experience.
yeah, I know, and some people we have, like we had the young doctor from Cork University Hospital here, who did come out with Tony Holohan a couple of months back and tell his story. Again, no underlying condition, but has been left very, very ill as a result of it, and it's still ongoing. We had the young athlete from Dublin who told her story and that, but you know, not everybody kind of will say to you, they're one-off, they're the outliers. That's not really the norm. So it is. I'd be more inclined to Nora's view, and I won't use bad language, but they should be telling people to stay at home, if you know what I mean, and not be mingling with people. And if you are going out, make sure you keep the 2 meters. Like the number of people I've seen coughing into their hand, or not even coughing into their hand, with no mask on, or sneezing and not doing it into the crook of their elbow, or no tissue and stuff like that. You just, like my own father, for example, who is 88, shortly, I don't know what all the panic is about. Kind of thing, you know. And up to last week was out and about, taking the bus, going to where he shouldn't be going, taking a lift from people without wearing a mask in a car. And I just lose the will to live with them. But sure, what can you do, you know?
You can only go so far.
You can only go so far. So the furthest I went with him was, okay, you pick it up, you go into hospital, no visitors, you die on your own.
Yeah.
And that's as stark as I was with him, but rolls off him like water off a duck.
Yeah, who are you to be telling him after all?
Roisin has her hand up there.
Yeah.
I do, Greg. Thanks very much. Great, really fascinating. Thanks very much for all your insights. It's fantastic. But I wonder what your theory or what your opinion would be on flights coming in and out of the country, and people still traveling. And the difficulty there is in ensuring that these people are going to quarantine or self-isolate.
Yeah, look, to be honest, and I'm speaking personally here, I thought it was a joke telling anybody coming from the UK that they had to self-isolate for 14 days, go into quarantine for 14 days. It didn't happen. The number of English registered cars that have passed me on the road, even this morning at about 6:45, one whizzes past me. And I said, where are they coming from or going to, as I was heading down to Cork here? And yeah, I just think we should have put the hand up. Like, I think 30,000 people came in from the UK over Christmas, and that's probably a very conservative estimate.
It's not just the UK, though. It is like, you know, there are flights from all over the world still coming in. And, you know,
absolutely, yeah.
The pudding is in the countries that actually closed down their borders.
Yeah. No, and the whole testing of people coming in, like, and you can test somebody coming into the airport and they could test negative. But if you were to test them 2 days later again, they could be positive, you know. So the test was only a moment in time. So completely agreed that how, and like, if you think we're bad, look across the border and the case numbers there and the number of people that have died on a daily basis up there in the last 2-3 months, like it's and you'd have to multiply their figures by 4 for us to have something equivalent to it. So you can see how difficult it is with the open border even, and hence Donegal, Monaghan, Louth, places like that, having very high numbers for the last couple of days.
Yeah.
But not for the last couple of days, for the last number of weeks, you know, months.
But one thing that, I mean, when Brexit negotiations were taking place, the last thing we wanted was a hard border. Maybe it's the first thing we want now, you know, that travel between north and south should be seen as a likely spreader of the virus. But how do you're not going to, the whole reason for not wanting a hard border was because of the sheer impossibility of imposing it, unless you do it by free will. And that's we're a long way from that yet. No,
it's down to personal responsibility, really.
Well,
isn't that how Australia managed it? They closed they have no borders, but they closed their states.
They did, and they blocked flights, and they did all of that, so they were able to do it. And New Zealand was the same.
You know, in your working life, Greg, you've always looked at the need of the customer, the patient, and in this case, you're looking at the state expecting patients or potential patients to do something that they wouldn't normally do. Do you yourself engage in the contact tracing, or are you just in charge of the system? In other words, you look after the people who are doing the contacts.
Yeah, that's really trying to ensure, because it is a very complex setup. Like here in Cork, we have now have 100. When I started out last March, we worked in UCC, and we had about 150 volunteers. So they were all people who worked in UCC or worked in local authorities that were no longer engaged in work because of the everybody kind of ceased back in last March and April. And that worked very well. And then we stood that down in June because the number of cases had got very, very low. But then come August, as the cases began to rise again, but we started this time out with employing people on a full-time basis. So we have about 120 people employed here in Cork on a full-time basis. So at any one time, we have 50 to 60 people contact tracing 12 hours a day. So it's and we're just one centre of about another 8 around the country. Like there's one in Limerick, there's one in Galway, there's several in Dublin, and a few other smaller ones. We also have the Army in helping out now, and we have some people from other government departments that are not fully engaged in other active work that they could otherwise be doing at the moment. So, and in relation to, we have had run a number of Zoom calls with patient groups, with patient representatives as well, in relation to different things that we were doing. So we were nearly calling on people once a week, and Zoom was great. They didn't have to come to Dublin for a meeting or whatever, so they could do it from their own sitting room, office, bed, wherever they happened to be, they could join us. And so an awful lot of stuff we did was kind of road tested by people in advance.
Right. I know
a few other people there in.
Yeah, Connie Ovison, who is the district governor for Rotary Ireland, has a question.
Thank you very much indeed, President Ian. And what a somber subject, unfortunately. We all know that, but unfortunately it's necessary for all of us, of course, to listen to this. And Greg, I must say, it's been fantastic to listen to you, because a lot of the things you have told us today, I'm sure a lot of people up and down the country have the questions. I have a few questions for you. Do you still see that there is a stigma of getting it among everybody, basically? do you want to answer that first, and I'll ask you the second question afterwards?
Okay. I would have thought earlier on there was more of a stigma to it, and people didn't want anybody to know, and hence didn't necessarily give us all their close contacts as well. I think there's less of a stigma to it now, because we just feel, probably because so many people across the country have got it. And we've, you know, in fairness to Tony Houlihan and his team, they've been trying to take the stigma out of it by saying, look, any of us could pick it up, and we don't know how we could pick it up. As I said, from knocking on somebody's doorbell unwittingly, you could do it. So make sure and carry the old hand gel with you everywhere you go, and use it and use it and use it. And it's like what Ian said about all the public health advice. But that's not to say within some of the what we're called the social inclusion communities, like the people in direct provision, like the traveling community, like the Roma community, there can be an awful lot of stigma attached to it as well, because you're seen to be bringing bad luck or whatever, and bringing unwanted attention on particular family and their contacts.
Yeah. Now, as I'm sitting here representing Rotary Ireland, which is both North and South, about 1,700 members, I'm about to, now after the holidays, we've all had a close down, basically. We haven't really communicated with each other. I'm here in a position where I literally, within the next, hopefully 24 hours, needs to send a message out to our members. Is there anything, you know, we are volunteers, right? You know, we are based in not most, but a lot of communities, cities, towns up and down the country. Is there any advice you could give somebody like me that I could send out to my members that could hopefully help in the next couple of months, where this is really still going to be very difficult, of what we could do? And secondly, is there anything we can do as volunteers that we can help you, what you do, or anything else that you can see in this whole process of trying to get the message out that we all need to be staying at home, basically? I won't use the word you nearly used before, but I feel like it.
Yes. Okay, just in relation to the advice, I tell people, including the staff here, and I wrote to them all on Saturday, and I said, it's our duty to follow public health advice as well. And that is the thing. Wear the mask when you're out, wash your hands, try not to touch your face, your eyes, your nose, your mouth with your hands. Keep your 2 meters, at least 2 meters and maybe 3 meters from people, and give good example. You know, as I tell people here, because like we don't have a huge space here, but I said, don't be afraid to pull me up if you see me too close to somebody. Challenge me the same as I will challenge you. And but you can't beat the example. So that's why I make a point. If I'm sitting down to help somebody do something, I'll ask them to stand up. I'll sit down. I'll sanitize everything before I use it, and when I'm finished using it, and they can sanitize it again. And it's really about our own behavior. And there is that, I don't know, Ian is much better at these things than I am, but if you want behavior, you must model it. So I don't know who is responsible for saying that, Ian, but I'm sure you know. And that's it, to give good example and to give that leadership in the community, but also in the community with older people and people who may be vulnerable or whatever, is maybe to offer to do shopping for them, to try and keep them in, you know, to do any other messages or anything like that that people need to do, or even just to phone them to see, are they okay, is there anything they need, just that, show that little bit of concern for people, I think will be worth, it's much better and more important than you know, and you do, I know some of the lads in Clonmel who are involved in Rotary, they take money off me every year to golf outing and what have you. And but that's good, and you know, so they do such fantastic work in the community, so they're there already, as an example to the rest of the community as to what they can do.
Thank you
So
very much. Very good to
that's
hear.
what I would
Thank
say.
you. Thank you very much. Appreciate it. Thanks.
I think,
Dermot, did you want to say something?
yeah, I think Martin Brett, Councillor Martin Brett has a question.
Actually, listen, I'm sitting here and listening to your presentation. I have to be honest with you, I'm stunned because most of the stories that you're telling are stories I've heard myself in more ways than one. Okay, I have 3 questions for you in relation to all of this. One, is our health service in a position or in a situation where it could actually break down? Because I don't like the numbers coming out, or the statements are coming out from Cork University Hospital stating that they had to close wards and staff are not available. Second part is, should we consider in some way along the way banning alcohol sales from, or curtailing alcohol sales from supermarkets or an off license? Because obviously this is the real cause of where the problem is going forward. And the third part is that, okay, and I hear your story with regard to the masks, but should we be shouting an awful lot more about putting gloves on, so that, okay, when we're touching or we're out or whatever else, and I note your comments with regard to your sanitizing all around you. But for instance, okay, the amount of people who are getting money from, say, cash machines, etc. Obviously, you don't know who's there before you. And as you say, you don't know how to trace them. But it's one of the things that actually sticks to mind. So, but more importantly, thank you so much for your presentation. I tell you something, this is something that should be kind of thrown out in an awful lot of ways for people to hear, because in fairness, even if it is, the latter part of the comment that you made was the what do you call it, the generation that's coming after us, this 18 to 25, that are coming after us. They're the ones who are going to have to pay for all of what's going on at this moment in time, and further generations that haven't been born yet. But I think we have to get the story out somewhere along the way and get people where we're coming from.
Okay, Martin, yeah, take your first question about the health service and breakdown. There's nothing, I suppose, the health service has a lot of resilience, and the people working in it are very resilient, but also the people working in it are very tired at the moment, because they have been dealing with this since the beginning of March of last year. And, you know, they're not immune from getting the disease no more than anybody else. Hence, unfortunately, if somebody is a close contact of somebody, even though there mightn't be anything wrong with them, we have to send them home for 14 days. Now, in some cases, there was a derogation from that back in the earlier days, but it is very resilient. The worry is that if services, routine operations start to close down now, we're just creating a huge backlog for whenever this vaccine is rolled out, and probably could be this time next year before we get back to normal service in hospitals. And so we've lost, what, 12, 15, I don't know, 18 months, I suppose, of what's on a waiting list, or added that to a waiting list. I can't see it, the service breaking down, because people will pull out all the stops. That doesn't mean that it's going to come under enormous pressure. We're very lucky this year, touch wood, so far no flu circulating. If there was flu circulating along with this, we would be in the depths of despair at this point, because we definitely would not be able to cope with the numbers. So in fairness, the hand hygiene, the wearing of masks, and that has worked, I would think, from that perspective, in that there is no great amount of flu circulating. But so I'm going to say the health service is not going to break down, but it will be running probably not at 100% full tilt as it should be doing, in doing hip replacements for people that need them, even though it's not deemed to be an emergency, in doing knee replacements, in maybe doing some cancer surgery or cancer treatments, and different things like that. But the essential ones, And if I'm the patient, what's wrong with me is essential, regardless of what other people deem not to be essential. But you have to prioritize some way or other. I hope we're not going to get to the stage like they had to do in Italy and New York, and start prioritizing and saying, well, if you're 94 or 95 and you come in, well, we're not going to treat you, or whatever is the case may be. And I hopefully don't see it. But again, we're back to people's own responsibility and doing what they need to do to ensure this doesn't happen. Because we can make all the calls and everything that we want to make, but if people don't show responsibility, and remember, it's their parents, their grandparents, their uncles, their aunts, they're the ones that will wind up suffering the most in all of this. Banning alcohol sales. Yeah, it's one that I have queried several times to say, how can this be deemed to be an essential service? You know, we close down all kinds of other shops that are not deemed essential, but yet, and hence the house parties, like we saw it in UCC, because it was not breaking any confidentiality, all the house parties down here in Cork by the students back in late summer, and they didn't get it in the pubs, so they had to get it in the off license. But that's a call for other people, not for me. If I had my way, personally speaking, yes, I would say we should, because I know I've talked to some shopkeepers and they said their off license has been their savior. They have made more money. They've been able to clear debts that they had that they were looking at for the next 10 years. But because of the off license sales, they now are sitting very comfortably. So
it's an ill wind that blows nobody any good, I suppose.
Yeah, well, that's it. There's always someone that will make money in a crisis. It's like all the people who made the masks, who made the alcohol gel and whatever else, you know, and fair play to them. They rallied to it. The gloves, I'm not so sure about, Martin, because they could give us a very false sense of security. And the gloves, you know, will pick up the virus, and it could stay on the glove for an awful lot longer than it will stay on your hand. And I'm always very conscious if I go to a bank machine, not that I go too often now, but the occasional time I do, to have that gel in my pocket, and the minute I finish, do it. I even do the card as well, sanitize it and whatever else, because you just don't know. There are so many touch points that you can't be careful enough.
I think, you know, that last line that you just said is perhaps a good one on which to finish. This meeting has actually gone on longer than any of the Zoom meetings we've had in the last 27 weeks. So I think it's a testimony, first of all, to what you had to say, but also people's interest in what you had to say. This is a topic that affects every single one of us. And, you know, it's going to be with us for a long time and going to shape our lives for the next number of months and possibly even years. The work that you are doing is it's part of the jigsaw in getting us out of this and helping us to deal with it. But I think your own personal ethics have helped enhance the service that you're providing. And, you know, whatever drives you as a person is the backbone of the contact tracing system, that the system itself is working, and it's part of the HSE that we don't often hear about. The HSE is a large behemoth of an organization that is often subject to criticism. But the individuals who are working on the ground are providing a service that are helping to keep us all safe and healthy. And I just want to say thank you for the work that you're doing, and also for enabling us to hear what you had to say today. If there's anybody who has any further question, maybe they could ask it very quickly, but otherwise I'd like to draw this meeting to a conclusion. I think people are putting up their clapping with applause. So I think, Greg, I'd like to say thank you, first of all, for your personal friendship over the years, but also for giving so much time and consideration to today's talk. And perhaps when all of this is over, you may be able to join us for lunch in the Clubhouse Hotel sometime when we're back to meeting as a club. It's one of the great clubs of Ireland. It's the largest Rotary club in the country at the moment. And we'd love to have you as a guest some Monday when all of this is over.
There'll be no problem, Ian, because as you know, I'm coming up to close to retirement and I'll be available.
Great.
But thank you all very much. And all I can ask you to do is to keep up the good work that Rotary does, and in doing that, to spread the message and live by example, really. Show people that you care, what you want to do, and keep the 2 meters and more if possible. Wash the hands, wear the mask. Remember the respiratory etiquette, cough, sneeze, whatever you have to do into the crook of the elbow, or use a tissue and put it into a bin with a lid on it. And in doing that, you'll keep yourself safe, but you'll also keep other people safe. So that's the important thing about it. And thank you all very much for your kindness and for sticking with me and listening. I do tend to go on a little bit.
No, but you see, it's the fact that so many people have stayed with us is testimony, I think, to their interest in what you had to say. So I'm going to draw this meeting to a conclusion, and I'd like to thank Greg on behalf of us all for giving us his time and his expertise, and look forward to next week's meeting when we'll have Niamh Mulholland talk to us about Rotary Foundation. Look after yourselves in the coming week, and thank you for being with us today. I'll have a recording of this ready later today. Bye-bye now.